Are you currently suffering from pain underneath or around your kneecap? That gets worse the more you bend your knee, such as things like squatting or going up and down stairs. If so, these are common symptoms of what's called Patellofemoral Pain Syndrome, which is a complex term that just means anterior knee pain. And unfortunately, it's estimated that 25% of people at some point in their life will experience this, but the good news is it's actually very easy to fix with the right exercises. For those who don't know me, my name is Dr. Zach Greenwood here at Performance Sport and Spine in Seattle, Washington. In today's video, I'm going to give you everything you need to know about how to diagnose this, some things to modify, and the best exercises to fix this using equipment that you have probably at home already. Okay, let's familiarize ourselves with the anatomy. If you look at this model here, this big bone up here is your femur or the thigh bone, the big bone of your upper leg. This right here is their kneecap or the patella, which is the thing that glides back and forth. This is the tibia, or the larger bone of the lower leg, and then the fibula, which is a smaller bone of the lower leg. And these blue things are meniscus, and these act kind of like shock absorbers or cushions to help keep the knee healthy. And this is your patellar and quad tendon, and then you have your LCL and MCL ligaments, which help stabilize the knee side to side. So with patellofemoral pain syndrome, the pain is actually coming between your patella or kneecap and the femur where it goes. And it can happen for several different reasons, which we'll get into later. But it's good to know that your pain is going to be coming from right here or right here. So you might be asking, well, how do I know I have patellofemoral pain syndrome versus some other condition that affects the knee? Well, this condition again affects pain underneath your kneecap, around the sides. It's often dull and achy, and it's with activity such as squatting, going up or down stairs, or kneeling. And the cardinal symptom with this condition versus other conditions that affect the knee is the more you flex or bend the knee, the more load is placed on it and the worse it's going to be. So a deep squat is going to hurt more than a half squat. This is most common in active adolescents, and it's more common in females than males. So if you have like a 13-year-old daughter that's playing soccer with knee pain, this goes top of the list. One thing to know is this is rarely seen in people over 60. So the good news is if you're over that, you're probably unlikely to have this. And again, 25% of people at some point in their life will suffer this condition, and it can be very mild to quite debilitating. So it can be kind of problematic if you don't do the right exercises and treatments. Now we know who's likely to get it and who's unlikely to get it, what actually causes this condition and the pain you're experiencing. Well, with like most non-traumatic musculoskeletal injuries, there's a huge overuse or repetitive stress component here. So think back the last few weeks or days or months. Have you been doing a lot more activity that stresses the bones over and over again? Well, if this is faster than the body can adapt or handle, the cartilage and other tissues around it can get irritated and painful. And then the more you load it, the worse it gets. So sometimes just resting a little bit or letting tissues calm down is really important. The second component here is how that kneecap or patella tracks within the groove. And there's some things that structurally can predispose you to get this. So the first is the orientation of your kneecap or your patella. So some people have what's called patella alta, which means your kneecap is too high, or baja, which means you're too low. And again, if it's too high or low, it's going to rub on that abnormally and maybe cause irritation. And if it's too extreme, you may have to have surgery to fix it. The next component is where that kneecap and the femur slides up and down in that groove. And sometimes it's abnormal or not shaped correctly, called trochlear dysplasia. And when this happens, part of it can get irritated because too much stress is going on one side rather than the other. Another thing to be aware of is where this tendon attaches to the tibia or the big bone of the lower leg, called the tibial tuberosity. And if it's too far to the outside, it will pull the kneecap out laterally this way, which can cause pain. The last thing to note with the alignment is the orientation of your femur or thigh bone. So sometimes it's angled a lot, which can cause excess stress here through femoral anteversion or geni valgus. Now, one thing to note with this is some research shows that this is a risk factor and some doesn't. So it's probably more about really extreme cases than anyone that just has mild cases, but it's something to be aware of nonetheless. And then lastly, there's a previous injury. Maybe you hurt yourself playing soccer or hiking a few decades ago, and the pain went away, so you thought the problem fully was fixed. But sometimes the pain's gone, but the tissue never heals 100%, making you more likely for a future injury. And since this is an overuse injury, you may have all three components together. These don't have to happen in isolation, and so just be aware that there may be 3 or 4 things going on, not just one singular cause. This is my favorite stretch for this condition, because remember that kneecap and that femur or thigh bone are getting pressed together, causing that irritation. So we want to distract or pull them apart. So in a seated position, you're going to put a big thick pillow between your leg, and then you're going to grab the bottom part of your ankle under the pillow and pull backwards. As you pull, you're gonna feel your knee stretch open. It should really feel good. Now this is kind of like mechanical Tylenol. It's not gonna fix it, but it's gonna help your day be a lot better. Recommend holding for 45 to 60 seconds, several times a day, as long as your pain feels better. One of the most important things from this video is to know that complete rest or full rest won't fix this. If you stop doing things, you'll probably experience less pain. But this is less because the problem is getting fixed and more because you're avoiding provocative activities. Until you strengthen those muscles and increase the bone tolerance for stress and work on that patellar alignment, this won't get better. So the good news is that with these exercises, and within 12 weeks, you will feel a lot better, but you can't just simply rest it, ice it, and take NSAIDs. You have to restore the function to get rid of the pain. You can't just simply rest to have the pain go away and then return to activity thinking that it will go well. A cool self-test or screen you can do for this condition is something that you're going to be in a seated position and your knee's at 90. And you probably want to have shorts on so you can see your knee. And you're going to straighten or fully extend your leg, watching your kneecap move. Now with a healthy normal knee, the kneecap should go straight down or perhaps straight down laterally a little bit or to the outside. But often with Patellofemoral Pain Syndrome, what will happen is the kneecap will go down and then it will bounce to the outside or the lateral pop. It's called a subluxation. So if you put your hand here, you may feel that it pops to the outside. I know what this feels like and what caused it. Now let's talk about how to get this better and get this resolved to get you back to doing what you want to do. Here are the 5 best exercises to get this better, and we're going to give you some options to substitute so you have some ways of modifying this for the different equipment you may have, so you have to go out and buy new stuff. First exercise is a leg press, a single leg version. So if you have access to a gym, you can just go there and do one leg at a time, making full to fully straighten that knee and activate that quad. Now, a lot of us that don't go to the gym don't have access to a leg press. So what you're gonna do is the first option is you're gonna get on the bench or the floor and you're gonna put a PT band under your midfoot with your knee slightly bent. And you're gonna hold resistance back with the arm and you're gonna press your leg away, make sure to fully extend or straighten that knee, and then come back. So this is a way to use like a banded leg press. So you can do this at home or on vacation, but make sure to fully straighten your knee and engage that quad or thigh muscle. The second option is use an exercise ball against a wall. So in a seated position, with the ball firmly against the wall, you're gonna have some tension with your knee bent. And then fully straighten or pressing your foot into the ball, activating your quad, come back to the starting position. So this is a way you can do a resisted knee extension or leg press with the exercise ball. To make it more difficult, you can scoot the chair closer, get the ball with more air pressure, or hold for longer durations. The next option is a knee extension. So again, if you're at a gym, just use the knee extension machines, but make sure to use them one leg at a time, not both legs. If you don't have access to a gym, here's 2 easy options. So the first is a banded one. So we're gonna have the band anchored, and don't just put it around once. What you're gonna do is pull it over and twist it around, and that way it's gonna anchor to your foot and ankle. Keeping your leg here, we're gonna contract our leg or thigh muscle, fully straighten the knee, come back. Some people may feel tension on the hamstring as you stretch it, but you want the contraction to feel right here. Go slow and controlled. Now with this, as you go out, it should be fine. But as you bend your knee, you might feel a little shake. Try to go slow through that because we're trying to control that patellar, that kneecap, in that groove, not simply go through the motions. Another alternative is to use the ankle weight. So again, in that seated position with the ankle weight around your lower leg, we're gonna straighten our knee fully, making sure to activate that quad or thigh muscle, and then return to the starting position. Again, do this one leg at a time so you can really focus on the injured leg and build strength and coordination. The next is squatting. And some of you may recall that squatting actually irritates this thing. So what we're gonna do is we're gonna limit our depth at first and then slowly build down. So what we wanna do is have a bench or a chair behind us so we can squat down to where it doesn't hurt and then come back up. Now if this is too low still and it's some pain, raise it up or just go down until you feel it and then come back up. And in subsequent weeks, try to build depth. Another option, if this is too painful initially, is to do a ball wall squat, which you demonstrate here. Now the step up. So with about an object that's either like a stair or a step that's about 6 inches roughly, we're gonna place the leg up, making sure to keep a vertical torso, don't lean too far forward, and then Trying to press off with the elevated leg, not the lower leg. Press up, pause, and then return. Now, some people may feel some discomfort or uneasiness. So what you may want to do initially, hand against the wall, making sure to use the elevated leg up, fully extend the knee, straighten it, and then down. Then over time, as you get more strength and comfortability, go without the wall. But slow and controlled is the name of the game here. Lastly, the sideline leg raise. So with your head, your back, and your heel against the wall, we're going to strengthen this lateral hip muscles to help control the knee. So you're going to raise your heel up as high as you can, feel some tension on the outside hip, and then return to the starting position. Try to keep your toe in neutral, pointing straight forward, and raise up, pause, and then return to the starting position. Do this on both sides, but emphasize the painful side at 3 sets and the non-painful side at 2 sets. Fortunately, there's some amazing hacks for short-term pain reduction with this condition that we'll talk about now. So the first is taping, and we give you some examples here. Now, this is highly recommended in the first 4 weeks to help reduce your pain, as long as you're also doing the exercises that we showed you. And this has helped the patellar track a little bit better. Now, there's not a one-size-fits-all, so you will have to try a little bit, but this is a really good thing that you should highly do. Second is foot orthotics, or things to help control your foot, especially with people that really pronate. So think of that arch is really collapsed in and lots of pressure on that big toe. Now, one thing to note with this is, again, it's recommended for the first 6 weeks as long as you're also doing exercises. But custom orthotics are no better than the store-bought ones. So go to some store, try them on. If they feel great, save your money. Don't spend money on expensive orthotics. Lastly, bracing is not recommended. So if you have this condition, don't go and get one of those heavy-duty knee braces, because that's not really going to help the problem, and it's going to further recondition or decondition the knee. Risk factors for this condition are activities such as running, squatting, or climbing up and down stairs, dynamic valgus, which increases patellar maltracking, being female, foot abnormalities, patellar instability, quadricep weakness, or overuse or sudden increase in physical activity levels. Well, that's it for today. We hope you found this video helpful. If you did like it, please like the video and subscribe to our channel. And don't forget to check out, we have a bunch of other great videos out there.